Hello guys, good evening. So yeah, let's wait for 2-3 minutes, okay? Actually, I'm planning to do my live at 6 p.m. So let us wait for 2 minutes, okay? Okay, guys, so let's start our live mock test. So yeah, almost 6 5 59 our timing. Okay, so let's start our mock test. So here is the first questions. No, just answer all these questions there. Then send me through mail, or you can just send me. My mobile number is already. I'm 9037038006 is my number. So you can just share the answers through WhatsApp or any mail midcodeeducation10@gmail.com. Okay, or you can just you know type all the correct answers in the comment also. Okay, yeah. So let's start with our first question. It's a post-operative diagnosis rectal prolapse. That is the post-operative diagnosis. Okay, what is the operation? Laparoscopy, proctopexy, and cystoscopy with the placement of unilateral uretral stent. That is the operation. So and also general anesthesia is taken. Okay, so this is the condition. So indication is also there, and the detailed operation is also mentioned. Okay, so take minimum 2.5 minutes per question. Okay, so it's an exact pattern of CPC exam, guys. So you can just take 2.5 minutes for taking per question. Here are the options. Okay, this is the first question. Mm, Already ICD code is also there, so you can take easily. First of all, you can take the ICD code, okay, first, and then take the appropriate CPD code. After taking the ICD code, you will get an idea about that which one is wrong. So eliminate the balance two options, then take the appropriate one. Okay. Three options are okay. Wait. So let's do the second question. No, no, no. Actually, can just do this question here. Fourth one. Wait. Actually, mistake is also there. So you have to do. Um, Let me take the correct one. Yeah, question is too big, guys. So that is why I'm skipping all the questions because it's too much big question. Yeah. 10th one, actually, the chief complaint means patient present with the bilateral thyroid nodules. That is the complaint. Okay. And history of present illness also mentions. Patient here, what is the procedure? Here, E&M, it is under the E&M code. The patient, 54-year-old patient, is here for evaluation of bilateral thyroid nodules. Thyroid ultrasound was done last week, which showed multiple thyroid masses likely due to multinodular goiter. Patient stated that she can feel the nodules on the left side of her thyroid. Patient denies difficulty swallowing and she denies unexplained weight loss or gain. Patient does have a family history of thyroid cancer. In her maternal grandmother, she gave no other problem at this time other than a palpable right-sided thyroid mass. So this is the condition. So what is the codes? 99214 is there, 215, 213, 212. So you can take the appropriate answer by after checking all the criterias in your medical decision making table. Because here there will be no complexity was mentioned, right? So you can take the medical decision making table in your E&M textbook, then take the appropriate answer. Okay, maximum try to solve a per question within 2.5 minutes. Okay, not 2.5, 2.4 is the exact time for solving all 100 questions in a mock paper. Actually, this question is also, big question. So I'm just skipping the big questions, guys. Yeah. So this question, the left inner thigh, actually here the diagnosis left inner thigh cutaneous abscess. Left inner thigh was prepared with the iodine and draped in a sterile manner. Local anesthesia, 1% lidocaine, WO epinephrine was administered by injection to the area adjacent to the abscess. A linear incision approximately 1 centimeter was made into the abscess. Upon incision, purulent material mixed with the serosanguineous fluid was evacuated. The cavity was irrigated with a simple saline solution to clean the wound uh, from any remaining debris. The site was left open to drain and heal. A sterile dressing was applied to the wound site with the tape. The procedure was uncomplicated and the patient tolerated it well. A sample of the material was collected for culture and sent to pathology for testing. This is the procedure. So already they have mentioned diagnosis also. So you can take the diagnosis code first, then take the appropriate CPT code. Let's solve another question. Mm. Actually, it's an anatomy question, guys. Which of the following records the electrical activity of muscle tissue in determining the strength of a muscle contraction as the muscle is stimulated? Option A sonomyography, option B electromyography, option C pylography, and option D myelogram. So which is the correct answer? Okay. 17th one. What is done when a surgeon performs a bilateral oophorectomy? Okay, bilateral oophorectomy actually it is a most important and repeated question in the CPC examination. Okay, what does bilateral oophorectomy means? Option A, removal of both ovaries. Option B, laparoscopic removal of the uterus. Option C, a sling procedure for vaginal prolapse. And option D, removal of both fallopian tubes. This is the correct answer. Bilateral oophorectomy. Very good, guys. All of them are commenting option A. Very good, correct answer. Here, option A, removal of both ovaries is the correct answer. Very good. Yeah. Next, 18th one. Which one is an organ of the lymphatic system? Which is the organ of the lymphatic system? Actually, this is also most important and repeated question. Option A, pancreas. Option B, pineal gland. Option C, spleen. And option D, vas deferens. Which is the correct answer? Very good. Manoj Kumar, correct answer. Shalini, correct. Option C is the correct answer. Spleen. Very good. Very good. Smart deals. Spleen. Correct answer, dear. 19th one. The phalanges are bone found in the dash. Chest, knee, wrist, feet, and hands. Which is the correct one? I remember because this question is repeated in my CPC examination. Phalanges. Yeah. Shalini, correct answer. Actually, the answer of phalanges, it means feet. Feet and hands. Feet and hands is the correct answer. Okay, phalanges bones found in feet and hands. Very good. Uh, no, Manoj. Feet and hand is the correct answer. Fourth option, feet and hands. Feet and hands. Okay, feet and hands is the fourth option, dear. Chest, knee, wrist, feet and hands. So answer is feet and hands. Yes, very good. Okay. 20th one. What is the macular ring around a lumen that contract to control flow through that lumen called? Lumen, okay. Here are the options: sinus, sphincter, snare, stricture. Yeah, this question, 20th one, the answer is option B, sphincter. Correct answer, Shalini. Very good, dear. Yeah. Okay, sphincter is the answer. Yeah, very good, Jennifer. And smart deals. Okay. Yeah. 21. Blood from the right ventricle is pumped through the pulmonary semilunar valve and eventually into the lungs through which of the following? Most welcome, dear. And Vadivel, D. Sphincter. Correct answer, dear. 20th one, sphincter. Very good. Stalini, welcome. One of my student said me about that this question, this question is repeatedly asked at his examination. Okay, blood from right ventricle is pumped through pulmonary mm, semilunar valve. 'Pulmonary artery', correct answer, dear. Yeah, very good. Pulmonary artery is the correct answer. Okay, option A is the correct answer. Yeah, Shalini, correct. Smart deals, correct. 22. Blood from the, sorry, already we 20, 21 and 22 both are same question. So I'm skipping and taking 23. Okay. Yeah, it is under the HIPAA. Okay. Which two rule must entities covered under HIPAA complete to? Two rules covered by HIPAA. What is the answer, dear? Anyone tell me which two rules must entities covered under HIPAA? HIPAA's, mainly HIPAA following or covering mainly two rules. Two rules are covered by HIPAA. Yeah, very good. Shalini, correct answer. Manoj Kumar, correct answer. Second one, privacy rule and security rule. Okay, these are the two important rules covered by the HIPAA. Okay, both of you correct answer, dear. Smart deals, correct. Next question, actually, yeah, one of the option is in the next page. I don't know, is it visible for you guys? Okay. According to ICD-10 guidelines for hypertensive cerebrovascular disease, what is the sequencing of codes? What is sequencing of codes in your ICD-10 guidelines? Option A, Assign the appropriate code from the category 160 to 169, followed by appropriate hypertension code. Not a one actually, I. Okay, I60 to I69. Okay. Second option, assign a code from category I25, other pulmonary heart disease, followed by the appropriate hypertension code. And the next is assign the appropriate hypertension code followed by categories of I60 to I69. Third option, assign code from category I60, hypertensive crisis, followed by appropriate hypertension. Okay. Here the answer is option A. Okay, option A is the correct answer, dear. Because, in this case, for hypertensive cerebrovascular disease, you must code the specific cerebrovascular condition first. Okay, followed by the appropriate code for hypertension. For example, here, if a patient has a hypertensive hemorrhage, the code category from I60 to I69, that is for cerebrovascular disease, comes the first, then the hypertension code. So, according to ICD 10 guideline, assign the appropriate code from I60 to I69, followed by the appropriate hypertension code. Okay, it is based on the hypertensive cerebrovascular disease. You have to code first code as I60 to I69, then appropriate codes again. So yeah, very good, Shalini. Smart deals. Uh, Gummar Gummar Vamshi. Wow, nice name. Okay, correct answer, dears. Yeah. Next is actually it's yeah. Which statement is correct according to CPT guidelines for code range? Okay, code range. Guys, take the code in your textbook 431802 43272. This is the range when bleeding occurs during an esophageal endoscopy. What is the correct guideline related to this scenario? Here are the options is also available. Option A, when bleed. Actually, this is a really a very easy question, guys. This kind of questions because it is directly present in your CPD text. So you don't need to think too much. Okay. Okay, Gumbarla Vamshi. I'm writing the CPC exam in December month. Okay, okay, December month. Okay. All the best for your examination, dear. God bless you. Yeah. So, time management is very important, guys. Per question, you have to take 2.4 or 2.5 minutes. Okay. Yeah. Take your textbook 431802 to 43272 and search the guideline related to this range of codes. Here, the options are look like a same, exactly the same, but some words are different in the all the four option. Okay. Option D is mentioned. Okay. Mm, T is for when bleeding occur because of an endoscopic procedure, control bleeding is reported separately during the same operative session. Yeah, correct. Mardil's correct. Jennifer Joseph correct. Okay, most welcome. Gummala Vamshi. Okay, Shalini correct answer dear. Option D is the correct answer. It is directly present in your textbook. You don't need any, not think too much for this question. Okay. Yeah, let's take another one. 26. Mm. What criteria must be met to append modifiers 24 to an E&M service during the patient's global surgery period? Here are the options. Okay, modify 24. Hmm? The E&M service occur. Option A, the E&M service occur during the post-operative period of another procedure. Option B, the physician performing the E&M service is different from the one who performed the previous procedure. Option C, the patient diagnosis documented must not meet the medical necessity of the visit. And option D, the current E&M service is related to previous procedure. Global surgery period. What criteria? It is option B is the correct answer, guys. Uh, Wait, the E&M service occurred during the post-operative period of another procedure. The physician performing. Yeah, B. Yes, B is the correct answer. Jennifer correct answer. Shalini correct. Okay. Okay. Correct answer. Yeah. Next is a very important question. But guys, the question is in the next page. Yeah. Maximum I try to. Oh, it's two, one, two, three, four. Uh, Yeah. Actually, this is also a repeated question. When a provider's documentation refers to use, abuse, and dependence of the same substance, example alcohol, which statement is not correct? What is the condition? Use, abuse, and dependence. Three of them are presented in your documentation. So, how will you code this scenario? Very important question. First option, if both use and dependence are documented, assign only the code for dependence. This statement is correct. Or if use, abuse, and dependence are documented, report all three codes separately. Third one, if both abuse and dependence are documented, assign only the code for dependence. Last one, if both use and abuse are documented, assign only the code for abuse. which is the correct documentation. Okay, so what is the answer option? Some more options are there. By guidelines, A, C, and D are, but this question answer is B. Question answer is, which statement is not correct? Not correct is mentioned. Okay, which statement is not correct is mentioned, guys. So you have to take the wrong code. Someone says B and someone says D. What is the answer? Which statement is not correct? Actually, option B is the correct answer. Second one is the correct answer. All the other, other options are correct one. For coding, abuse and dependence are mentioned in your question first, then abuse code also. You have to take the dependence code first. Use abuse is present, take abuse. Abuse dependence is okay. That is also correct. So in this question, option B is the correct answer. Okay, use, abuse, dependents are documented. Report all three code sets separately. That is not correct. It's a wrong code. Okay, very good, Jennifer. And smart deals, correct answer. Manoj Kumar, also correct, dear. Shanila, correct answer. M Tour, correct. 29th one. What is 29th question? According to CPT coding guideline, which scenario best represent modifier 24? What is modifier 24? Just to check the modifier 24 first, then read the scenario mentioned in our question. Now, all the scenarios are entirely different, all the options. First option is patient is coming back to have stitches removed from his hand within the post-operative 10-day global period of the repair. So patient had an that is the first option. Second option, patient had a hernia surgery 2 days ago. Um, 2 days ago and returns to the operating room to incise and drain a post-operative abscess. Third option, patient had an appendectomy 2 weeks ago. Patient returns to see physician who performed the appendectomy complaining of a swollen right foot. The physician examines the swollen right foot, providing an E&M service which is unrelated to the appendectomy within the 90 days post-operative period. And next, new patient is seen in the physician office for effusion on the left knee. Physician examines the patient and perform a minor surgical procedure aspirating fluid from the left knee. What is the answer? C, correct answer. Yeah, yes, correct answer, guys. Actually, modify 24, it is for a, the CPT code, it is used for healthcare providers to, uh, modify 24. Actually, the meaning of modify 24 is healthcare providers indicate to an unrelated evaluation and management E&M service and was performed during the post-operative period of previous procedure by the same physician. Unrelated evaluation and management service. Right. So this is the modify 24. Yeah. Correct answer. Option C is the correct answer. Very good. Smart deals. Correct answer. Jidin. Uh, actually, answer is C. Okay. C is the correct answer. Shalini. Correct answer, dear. Gumerla Vamshi. Correct answer. Shanila. Correct answer. Very good, guys. Okay. So let us take the 13th one. Wait, 13 not present, guys. 32. Okay, let us do the ICD question, guys. Okay, the CPT, both both combination of both questions in your question paper. Okay, CPT, in CPT session you can expect CPT plus ICD also. Some combination of CPT codes and ICD codes. Okay, so just to solve this ICD, an elderly patient comes into emergency department ED with a shortness of breath and ECG is performed. The final diagnosis at discharge is okay. According to ICD 10 cm guideline, how is this? Okay, so I20.0 is there, I21.3 is R0 6.02, R0 6.02, I20.0, R0 6.02. 32. Yeah, B is the correct answer. Very good, guys. So, yeah, you have to code for I-21.3 and R0 6.02 also. Okay, B is the correct answer. Very good. Um, Okay, so because here the admission for encounter is shortness of breath, right? And the final diagnosis impending myocardial infarction. So you have code for both. Patient comes into because in ED for emergency department, so you need to code that also because option B is the correct answer. Okay. Yeah, 33. A 58-year-old male suffered an acute STEMI of the inferior lateral wall while running a marathon on June 15 and had received a treatment 3 weeks later. The patient presented to the ED complaining of SOB and left arm pain. Actually, what is SOB? SOB means shortness of breath, okay? Shortness of breath. And left arm pain, and EKG is performed as well as a blood test. Patient is admitted for further evaluation. What is the diagnosis code is reported for this encounter? Yeah, I-21.19, I-21.3, I-22.2, I-21.29. This is the options. Actually, guys, this question paper is little bit important because a lot of students are repeatedly saying me about that this question paper, this questions are asked in their CPC examination. So I wondered about this question actually. Yeah, so this 133, which is the answer? Yes, very good. A is the correct answer. Very good. Manoj Kumar, Gumbarla Vamshi, Mansu, correct answer. Option A is the correct answer. I-21.19. Okay. Yeah. Next is 34th one. A patient is diagnosed with a benign hypertension and congestive heart failure. The providers indicate that both conditions are unrelated to each other. According to ICD 10 guidelines on ICD 10 guidelines on hypertension, how would should this encounter be coded? No, Jidin. Option B is the wrong code. Previous question, the answer is option A. Kalni, correct answer. Actually, in this option, there is a printing mistake is also there, dear. Um, 4 is not here. Okay, 4. Third option, 4110 is mentioned, not 4. Actually, I10. I10 is there. Okay, I10, comma, I50.9 is there. Correct, Manoj. Correct answer. Option C is the comma I50.9. I10 and I50.9 is the correct answer. Manoj Kumar, you are right. No, no. Actually, option C is the correct answer. Okay, C correct answer. Okay, so let me take another question, dear. Yes. Actually, nowadays, this kind of COVID-19 questions are repeatedly asked in every question paper. Okay, you can expect in this December month, if you are planning to write your CPC examination in December month, you can expect COVID-19 question also. Nowadays, COVID-19 questions are very important in the ICD 10 codes. Solve this question 35. The patient who is at 32 weeks pregnant, hospitalized due to an infection of COVID-19. Her current symptoms are shortness of breath and high fever of 103 degrees for the past 2 days. She is currently on supplemental oxygen and under strict observation. What is the ICD 10 codes are reported? Okay, yeah, sure. Actually, no, everyone want to answer this question there, so that is why I'm going little bit slow. Okay. Uh, okay, okay. Yeah. That question you have, 2.5 minutes is there. So yeah, everyone want to solve this. Why I'm moving with very slow. Okay, no issues. Okay. Yeah. Try to solve this 35th question. No, no man's consultancy. Actually, no, no, no. B is not a correct answer, Manoj. Actually, guys, if you don't know about the guideline for a pregnancy, is there any pregnancy is mentioned in your question? You have to main priority in pregnancy chapter, right? Main priority in pregnancy chapter. So, here also a pregnant lady is suffering COVID-19, right? So first of all, you have to code for a pregnancy. That is the main high. Pregnancy chapter has most prior than other chapters. So if you found any pregnancy related things in your question, you have to code for that pregnancy first of all. Okay, that is more prior than others. So pregnancy is very important. Other malfunction conditions. Okay, B is not a correct answer. Yes, smart deals. You are right. Option A is the correct answer. Yeah, Shalini, correct answer. Option A is the correct answer. Oh, 98.513 correct answer. That is for pregnancy related and use 7.1 for COVID-19. Okay, and is a 3A that is related to another condition. So option A is the correct answer. Mass consultancy, correct. Shalini, smart deals, correct answer, guys. 36. This one is also very important. The Mohs micrographic surgery code. A surgeon performed Mohs micrographic surgery on a lesion on the right arm. This required two stages. Okay, stage 1 had 6 tissue block and stage 2 had 3 tissue blocks. What will be the code? Two stages are there. Okay, so in this kind of questions, you have to understand the anatomical side first, then eliminate the other things, then concentrate the number of stages and tissue blocks. Here, two tissue blocks, two stages are there, and six number of tissue block. First stage contains 6 tissue block, second stage contains 3 tissue blocks. The correct answer. Manoj Kumar, right. Option A is the correct answer because 313 313 for first stage and 314 for second stage. Correct answer. 313, and you never seen any kind of uh, another other option. So option A is the correct answer. Yeah, 37. Yes, Shalini, correct. Manoj, Shalini, it's correct, correct. What about this question? 37. The surgeon first performs a bilateral blepharoplasty of the upper eyelid by excising excessive skin veining then down. Next to the blepharoplasty is performed bilaterally on the left lid. What CPT code is reported? Okay. Yeah, so this question answer is, yeah, option A correct answer. Smart deals. Shalini, Jidin correct answer. Option A is the correct answer. Very good, dear. Darling, Sagi, Shalini, correct, correct. Yeah. So it's a little bit big question. Manoj Kumar, correct answer, dear. Option A. Okay. Solve this 38th one. A patient present to the ER from a nursing home after the patient was found to have foul smelling, large sacral pressure ulcer during daily nursing rounds. The ER provider swabbed the wound for culture, which measured at 7 centimeter in largest diameter, then cleaned the site before painting with the povidone around the entire sacrum to reduce cutaneous bacterial load. The providers made an elliptical excision with the 3 mm margins around the outer edge of the ulcer and removed the lesion in its entirety. Further examination revealed deep tissue damage, prompting muscle and segmental bone removal. The wound was then closed using a layered skin flap closure. That is the CPT and ICD-10 same coding. Okay. If you have any doubts with the CPT, identifying the CPT code, check the ICD one day. Then eliminate the other two options. Option A and B, ICD codes are both are same. L89.156, right? So you can just check the 156 code first, then 153 code second. Then take the appropriate one, eliminate other two options. Then find the appropriate CPT code by comparing the two codes with the question. Solve this question. What is the answer here? Type the answer, guys. Yes. A. Manoj, correct? A is the correct answer. A is the correct answer. No, no, no. Just check the code again. Man's consultancy and Shalini. Option A is the correct answer. Mm, no, option B, second one is the correct answer, guys. Okay, sorry, option A, 15935. A is the correct answer. Manoj Kumar is right. 39. A physician used electrosurgery to destroy 14 actinic keratosis on the temples and cheeks. Uh, he also removed 10 skin tags from the neck. Actually, temple means it's a skull bone. Okay. Actually, it is located at a juncture where four skull bone fuse together. Temple means it's tie in the eyes. Actually, it is tie in the eyes area. Okay. Yeah, sure, smart deals. I will explain. This question, temples and cheeks means temples are present in the face area, dear. Face. Okay, it's a forehead part or eye area part, the skull area of the face. That is temple. And cheeks, cheeks is also there. It is in the face area. Uh, electrosurgery is done by the physician. 40 actinic keratosis are there. He removed 10 skin tag from the neck. This is the procedure. Here, two procedures are mentioned. Okay, two procedures are mentioned in our question. What is the answer? Yeah, correct. Manoj Kumar, correct. And Man Consultancy, correct answer. Gummarla Vamshi, correct answer. Option A is the correct answer, guys. Okay. So here, what is the procedures? Removal is mentioned here. So 11200 is a common option, and the next one 17000 for destruction code, right? And also here 14 actinic keratosis are destroyed. So just that is also option A is the correct answer. Okay, very good, Shalini. Very good. All the other students, Kumaralam, Sheeman, Consultancy, Manoj Kumar. Okay. Smart deals? Okay. Yeah. 14 to 1. A plastic surgeon performed a rotation flap tissue transfer for a patient with an 8 centimeter defeat across his upper left cheek. Scar tissue has formed from a previous Mohs surgery for basal cell lesion, creating tension. What CPT and ICD codes are reported for this procedure? Okay, smart deals. A correct answer. It. Here also, mm, rotation flap tissue transfer mentions, and yeah. So what is here? CPT code is also there. ICD code is also there. Okay. So check the codes, both the codes, then take the appropriate answer. Very good, Jidin Narayana Swami. Option A, correct answer, dear. Very good. Wait. Let me check the code once more. No. Uh, Sorry. Option C is the correct answer. C is the correct answer. Okay. C is the correct answer, dear. because 14060 is not a correct one. 40 is the correct option. Okay. Stream lag. I don't know, dear, because some network issue maybe. Yeah, C correct answer, Jitin. Narayanaswamy, Gumarala Vamshi, correct answer, dear. Shalini also correct. Okay, my first comment is Shalini. Shalini correct answer. Option C is the correct answer. Manoj Kumar correct, dear. Okay, so let us take the another question. 41. A physician performs a excisional wounds. A wound on the lower back measures 12 centimeter and involves the fascia for the debridement. A wound on the left shoulder measures 8 centimeter and one on the left lower leg measures 60 centimeter involves subcutaneous tissue for the debridement. What CPD codes are reported? Here full of excisional debridement codes are mentioned in our question, guys. Try to take the code. No. Manoj, just concentrate the code here. What is the answer, guys? Answer for this question 41. Here C is the correct answer. Okay. C is the correct answer, guys. This question. C is the correct answer. Okay. 11043 and 11046 is the correct answer. Let me take the another question. 42, a 42-year old with uh, with medial epicondylitis is scheduled to receive an injection at the provider's office. The area of maximal tenderness is palpated and a needle is introduced under introduced under ultrasonic guidance, injecting the horizon, permanent recording and reporting are in the record. What is the CPT code for the surgical procedure? What is the surgical procedure code? What is the answer for this 42, question number 42? What is the answer, guys, for this 42 question? I think our stream it become little bit lag. Yeah, Manoj Kumar, correct answer. Option A is the correct answer. 20606 mode and LT is also there. LT is for left side. But in our question, they have not mentioned it become left side procedure. But in every option, you can see that option A, very good, correct answer. Okay, you don't need to use any ultrasound guidance code separately because already that code 20606 contain the particular imaging guidance. They have mentioned that particular imaging guidance, so you don't need to code extra for that. Okay, so option A, Manoj Kumar, very good. Correct answer. A is the correct answer. Okay, so let me take the another question. 43. A patient present with the pain and spasm in the right scapular area. Trigger point injection were placed in infraspinatus and supraspinatus muscle of the right scapular area. What procedural coding is reported? Here are the options also. Gumbarla Vamshi, correct answer. Dear M2, correct answer. Option A, correct answer. Okay. This 43 question is very important, guys, because it is for a trigger point injection code. Trigger point injection code is in 20 case series. It's very most important. Are you able to see my screen? Complete option, dear. If you're not able to see my screen, just DM me, okay, in the comment section. 20552 into 2 first option, 20553 second option, 20552 third option, 20560 fourth option. Okay, what is the answer for this question, guys? Our stream is little bit lag, maybe. I think. Yeah, Manoj Kumar, very good, dear. Option C is the correct answer. Very good, dear. Option C, correct answer. Okay, C20552 is the correct answer. 44. A patient, M2 correct answer, dear. C correct answer. Okay. 44. A patient's left eye is damaged beyond repair due to a work injury. The provider fabricates a prosthesis from silicon materials and makes modifications to restore the patient's cosmetic appearance. What CPT code is reported? Option A 21088, option B 21080, option C 21077, and option D 21086. Yes, very good. Bumala Vamshi, option C is the correct answer. 21077. Eye prosthesis, yeah, eye prosthesis orbital. Correct answer, dear. Option C is the correct answer. Very good. It is related to eye damage, right? And also they have mentioned prosthesis procedure. So, correct answer, dear. Very good. 45. Kadi broke her wrist while on a hiking trip, and a gauntlet cast was applied by the local ear physician. She goes to her primary care providers 1 month later to have the cast removed. What CPT code is reported for the primary care provider? Option A 29584, option B 29280, option C 29700, and option D 29705. What is the correct answer for this enquiry? Very good, Manoj Kumar. C is the correct answer. 29700. Very good. Okay. 29700 is the correct answer for this encounter. Gauntlet, yeah, very good. Kumarlavamshi, C, gauntlet removed. Correct answer, dear. Okay, so this kind of question is also important. Caste removal. Okay, caste, application of caste, caste removal is very important. Just note it down in your CPT textbook. Okay, just highlight the code in your textbook. It will become more useful for your CPC examination. Okay. Hmm. So 46. A patient is diagnosed with a compression fracture of the L2, L3, and L4 vertebrae. The patient agrees to have kyphoplasty. A balloon catheter is inserted in the vertebra and inflated, restoring the height of the vertebra. Bones cement is injected in the vertebral space until the whole L4 body is filled. The same procedure is performed on the L2 and L3 levels. The procedure is performed bilaterally on the three vertebrae. What CPT coding is reported? Option A 22515 into 2 3. Option B 22514, 22515 into 2. Option C 22514 modifier 15, 22515 modifier 15 into 2. And option D 22514 modifier 15 into 3. I just solve 50 questions. Okay, here now it's 46 is there. Let's solve 50 questions then wind up the session. Yeah, very good, Gamarla Vamshi. Option B is the correct answer. B is the correct answer. 22514, 22515 into 2 is the correct answer, dear. Hmm? Okay, Manoj Kumar, check the code clearly, dear. B is the correct answer. Okay, 47. Are you able to see this all the options, guys? If you are not visible these options, just DM me. Okay. I know this question is too big. Actually, this question answer is option A is the answer. Okay, A is the answer, dear. 254,007 modified 78. Okay, and mm, T84.122A S52.301P is the correct answer. Okay, A is the correct answer. Yeah, 48. An obstruction remove bilateral. Yeah, okay, no issues, server issue. I know, dear, because it's a full of online live session, so that is why some network issue is also here and also there. I know. No issues. Okay. An obstruction removes bilateral external iliac, internal iliac, and obturator nodes laparoscopically for total pelvic lymphadenectomy. What is the CPT code? 38572, 38571, modified 15572, modified 15571. Okay. What is the answer for this question, guys? D. Yeah. D is the correct answer. 38571 is the correct answer. Okay. Gumarla Vamshi, correct answer, dear. M Tour, correct answer. Okay. D is the correct answer. Very good, Manoj Kumar. Very good. D is the correct answer. 48 D. Very good. Yeah, 49. The patient has an aneurysm in the ulnar artery. The provider makes an incision and dissects down and around the ulnar artery. After clamping the distal and proctory, the provider cuts out the defect, switches the remaining ends of the artery together, and places a graft uh, to fill the gap. What's CPT code is there? Okay, ulnar artery. 35151, 35132, 35045, 35081 is also there. Yeah, take the appropriate answer, guys.